Namaste. Today I am talking about the COVID-19 frontline healthcare workers at risk of the mental health problem. Facing this critical situation, healthcare workers on the front line who are directly involved in the diagnosis, treatment, and the care of patients with COVID-19 are at risk of developing psychological distress and other mental health symptoms. The ever increasing number of confirmed and suspected cases, overwhelming workload, depletion of the personal protection equipment, widespread media coverage, lack of the specific drugs, and a feeling of the being inadequately supported may all contribute to the all mental burden of these healthcare workers. Those healthcare workers feared contagious and infection of the family, friends, and colleagues, felt uncertainty and stigmatization, expressing high level of stress, anxiety, and depression symptom, which could have the long-term psychological implication. Similar concern about the mental health, psychological adjustment, and the recovery of the healthcare workers treating and caring for the patient with the COVID-19 are now raising. Psychological assistance services include the telephone, internet, and application-based counseling or intervention has widely developed in the local and the national mental health institution in response to the COVID-19 outbreak. Mental health problem among healthcare workers treating patients with the COVID-19 by the magnitude of the symptom of depression, anxiety, insomnia, and distress, and by analyze the potential risk factor associated with these symptoms. The role of the psychiatric nurse during the coronavirus outbreak, emerging infectious disease outbreaks such as the COVID-19 cause significant fear and uncertainty. Psychiatric nurse can play an important role in supporting the well-being of the patient and the family, healthcare personnel, and the general public. Infectious disease outbreaks produce a range of the psychological and behavioral effects. Inform patient about the common responses such as the insomnia, anxiety, fear of the illness, or the desire to increase the alcohol and tobacco use. Children and adolescents may experience regression, social isolation, or the aggressive behavior of aggressive behavior, all of which can be misinterpreted as acting out. Educate patient on way to reduce the overall stress, such as the getting adequate sleep, eating regular meals, exercise, staying connected with the friends and the family, and the relaxation technique. Inform patient when and where to get help if needed, and recommend the health promoting behaviors in recommendation of the patient to use the trusted resources or the trusted sources such as the Center for the Disease Control and Prevention to obtain the most updated information on keeping their family safe and healthy, which can decrease distress, encourage patients to develop a family plan for the dealing with the outbreak, which remind people there are the steps they can take to care for themselves. Knowing your work and your daily plan or the school plan or the college plan for the dealing with COVID-19 also help reassure people about steps being taken by the others to safeguard their health. Recommend the patient to limit exposure to the outbreak related traditional and social media. Increasing media exposure is often associated with a higher level of the distress. Preparing your practices, yes, definitely promote frequent hand washing with the soap and water or the 60% plus alcohol based hand rubs. Encourage respiratory protocols or the manners like the covering cough and sneeze. Provide tissue and fresh receptacle or the discourage sharing of the item and equipments like the mobile, pen, desk, chair, like that. And maintain regular housekeeping practices including the cleaning and disinfecting surfaces, and permanently identify and isolate potentially infectious individual, and maintain the social distance as much as possible, and supporting the healthcare system Most patients with COVID-19 illness-related concern will present in the primary and emergency setting. Psychiatric nurse can play an important role in the optimizing population mental health by the providing interdisciplinary education like consultation and collaboration of the help the colleagues more effectively identify outbreak related distress responses and provide early intervention. Non-infected patient experiencing illness related distress should have their concern validated, which also helping them learn way to the more effectively cope. Intervention should severe to the enhanced feeling of the safety or the calming self and the community efficacy, social connectedness, and hope of the optimum about the futures. Then facilitating problem solving, how to facilitate in that in uncertainty about the future is common and best addressed through the practical problem solving. For instance, psychiatric nurse can help people consider alternative social greeting when handshaking is the discouraged, or the explore technology based mean of the connecting for the community activity when social distancing measure recommended. Avoiding large group gathering, encourage family to involve children in the problem solving, which can decrease feeling of the distress for the kids. Reminding people there are the step they can take to the manage through the challenges, enhance calming or the increasing self-efficacy, and reduce the feeling of the helplessness. Empower ill patient, their families and the care providers. Psychiatric nurse can empower patient families and care providers through the education about the psychological effects of the isolation and quarantine. Short-term effect may include the anxiety, anger, fear of infecting others, and frustration. With those who experience a long period of the isolation being more likely to develop post-traumatic stress symptoms or increase substance use. Ensuring quarantine patients have the adequate supply and that they and their families are given comprehensive ongoing updated information, reduce distress and uncertainty. The use of technology to connect a patient with the family, friends, and their healthcare team can decrease feeling of the isolation. Encourage provider self-care like COVID-19 and other infectious disease outbreak severely stress health system and the provide working within them. Routine and ongoing self-care help providers function more effectively at work and home. Sleeping, eating, hydration, maintaining hydration or the hydrating, and taking breaks are important during the work day. Providing support to peers, like the finding constructive solution to work challenges and staying connected with the family and friends can lower overall stress. How to best support to the patient is stay informed, check reliable sources, educate patient to correct the patient misinformation, and encourage patient to limit media exposure, and discuss stress reaction, how to recognize and how to address them. Identify and support high risk patient, and don't forget to take care of yourself. And the rights, role, and responsibility of the health workers, including the occupational safety and health. Health workers are at the front line of the any outbreak responses and such as the exposed of the hazards that put them at risk of the infection with an outbreak pathogen in the COVID-19. Hazards include the pathogen exposure, long working hours, or the psychological distress, fatigue, occupational burnout, stigma, and physical and psychological violence. This document highlights the right and responsibility of the health workers, including the specific measure need to the protect occupational safety and health. Health worker right include that employers in the health facilities assume overall responsibility to ensure that all necessary preventive and protective measures are taken to the minimize occupational safety and health risk. In that, provide information, instruction, and training on occupational safety and health, including like the refresher training on infection prevention and control, and use the putting on, taking off, and the disposal of the personal protective equipments. In that, provide educate infection prevention and control and PP supplies like the masks, gloves, goggles, gown, hand sanitizer, visor, soap, and water cleaning supplies in sufficient quantity of the healthcare of or other staff caring for the suspected or the confirmed COVID-19 patient, such that workers do not incur expenses for the occupational safety and health requirements. And in here, the familiarize personnel with the technical updates like COVID-19, and provide appropriate tools to the assist tries, test, and treat patient, and to share information, prevention, and control information with the patient and the public as needed. Provide with the appropriate security measure for the personal safety. Provide a blame-free environment for the workers to report on incidents such as the exposure to the blood or the bloody fluid from the respiratory system, or to case of the violence, and to adopt measures for immediate follow-up, or the including support to the victims. Advise patient advise the workers on the self-assessment symptoms, reporting, and staying home when ill. Maintain appropriate working hours with the breaks, and consult with healthy workers on the occupational safety and the health aspect of their work, and notify the labor in suspected of the cases of the occupational disease. Not be required to the return to a work situation where there is the continuing or the serious danger of life or the health until the employer has taken any necessary remedial actions. Allow workers to the exercise the right to the remove themselves from a work situation that they have the reasonable justification to the belief present and imminent and serious dangers to their life and health. When a health worker exercise this right, they shall be protected from any undue consequences. Provide access to the mental health and counseling resources, and enable to cooperation between the management and workers and other representative. Health workers should do the follow established occupational safety and the health procedure, avoid exposure other to the health and safety risk, and participate in the employer provided occupational safety and health training. Use provided protocols to the assist the treat and the treat patient, treat patient with the respect or the compassion and dignity, and to maintain the patient confidentiality, and strictly follow the established public health reporting and procedure of the suspected and the confirmed cases. Provide or the reinforce accurate infection prevention and control and public health information including concerned people who have the neither symptom or the risk. Put on use, take off, and dispose of the personal protective equipment properly. Self monitor for the sign of the illness and self isolation, or report illness to the concerned person if it occurs. In advanced management, if they are the experiencing sign or undue stress or the mental health challenges that require support intervention, and report to their immediate supervisor any situation which they have the reasonable justification to the belief present an imminent and serious danger to life or the health. So thank you so much for the listening.